I think there's a puzzle overshadowing us at this moment, which is how much will this matter about what the evidence is if it's not valued? And I think that we're at a time where in the global health space, this kind of knowledge is highly valued and used directly to drive practices into action. And I don't know which way in the US we'll find knowledge about different kinds of programs and practices, and whether what improves coverage and what doesn't improve coverage will be valued in the immediate period of this administration. But what I do know is that those kinds of data are going to matter in the long run. The critical parts are going to be whether we truly understand what happens to the most vulnerable populations, and that we don't ignore those vulnerable populations. When we did our work around trying to drive surgery results in Massachusetts, we knew it was not going to be something that could influence the whole country if we just did it in Massachusetts, because we have such a different profile from Middle America. And so taking the time and effort, as JPAL has, to work in South Carolina, a median state with at the 50th percentile of income, 50th percentile of population, and a politically diverse setting, gives us much more chance of understanding and speaking to the people who are actually going to listen and actually matter. And so I ask that you take those considerations into account as well as you think about the work you're going to do. I don't think it could be more important to fortify there couldn't be anything more important than fortifying our institutions of science. The roles of evidence will only increase, not decrease, as the coming years unfold.